So our third lectures, named by sterilization and disinfection principle of surgical asepsis. So it's we continued previous lectures, and we will talk about these terms, very important features of surgery. Common definition. So the most severe condition after surgical infection, it's a sepsis. Sepsis presence of pathogenic microorganisms or their toxic products in the tissues of a patient. Asepsis, it's the absence of pathogenic microorganism in living tissues. Aseptic technique, the clean practice used to remove or destroy pathogens and to prevent their spread from one animal or people or place to another animal, people or place. Antisepsis, it's a prevention of sepsis by the destruction or inhibition of microorganisms using an agent that may be safely applied to living tissue. Antiseptic, it's a chemical agent that either kills pathogenic microorganism on inanimate tissue. Yeah, we talked about it before. Disinfectants in which can destroy and inhibits on inanimate object. Disinfection is the removal of microorganisms, but not necessarily their spores and viruses found on non-living objects. And sterilization is a complete elimination of microbial viability, including vegetative forms of bacteria and spores by physical or chemical means. Transmission of microorganism, so transmitted microorganism by three ways. It's a hospital staff, contaminant instruments, and by environment. Source for contamination, it can be surgical personnel, non-sterile barriers like surgical clothing, scrub tops, surgical head cover, and face mask. Sterile barriers, it's a gloves and surgical skin scrub. Source of contamination, it's a patient, operating theater environment, and surgical equipments. Principles of surgery asepsis. Following are the principles of surgical asepsis. First of all, use only sterile items within a sterile field. Scrubbed personnel are grounded and gloved. Sterile personnel operate within a sterile field. Personnel touch only sterile items or areas. Unsterile person touch only unsterile items or areas. Yeah, it's a very easy, but it's a base of surgical asepsis. Sterile drapes are used to create a sterile field. All items used in a sterile field must be sterile. All items introduced onto a sterile field should be opened, dispensed, and transferred by methods that maintain sterility and integrity. A sterile field should be maintained and monitored constantly. Surgical staff should be trained to recognize when they have broken technique and should know how to remedy the situation. So levels of sterility on the basis of magnitude of the risk of infection. The use of surgical instruments and equipment can be classified into three categories. First, it's a critical, include surgical pack instruments. Semi-critical, it's an endotracheal tube, for example, and non-critical, it's a face mask and rebracing bags. Preparation for surgery, it involves surgeon's preparation, which wearing of surgical head cover, mask, surgical gloves, hand scrubbing, hand drying, going and glowing. So 7 actions, step by step. Patient preparation, hair removal, skin preparation, and patient draping. Scrub solutions, commonly used scrub solutions are chlorhexidine, excellent spectrum, occasionally sensitive to mucous membrane, or povidone iode, it's excellent spectrum, also occasionally skin sensitive. So at these pictures you can see wrapping instrument package by step A, B, C, D, E. In this also how it open, yes, by the step also, folding and wrapping surgical gown, and last one, it's the unwrapping of sterile tags. So it's a base of repeated. It's a base of all sterile principles in surgery. At this figure, you can see hand scrubbing technique. So it's medical. Yeah, we had three types of hand washing. It's a social, medical, and the surgical. So this one, it's a medical, which had 6 actions. In these figures, you can see steps in surgical gloving: first, second, third, fourth, 8, and 6 steps. Sterilization and disinfectants. It's a destruction of all the microorganisms, including bacteria, viruses, spores, from objects, instruments, drops, catheters, needles, and blades that come in contact with tissue or enter into the vascular space. Disinfection, process of destroying microorganisms except viruses and spores found in inanimate objects. Methods of sterilization: it can be physical, chemical, gas sterilization, and irradiation. Physical sterilization: most commonly used sterilization method, use dry or moist head. Dry head, it's a mechanism of action, denaturation or destruction of cellular proteins, and flaming, used to sterilize the instruments like a blade, needles, passing over the flame of gas burner till red hot destroys bacteria. Hot air oven, it's the most common and effective method of sterilization and of metal instrument and glassware. So temperature approximately 120 degree for 8 hours, or 140 for 2.5 hours, 160 for 1 hour, and 180 for 20-30 minutes is usually sufficient. Moist heat, mechanism of action, denaturation of measure cell, constitutes boiling, of course. Most effective method of sterilization uses temperature of 100 degree for at least 50 minutes to sterilize syringes and needles. Autoclaving, moist heat also in the form that saturated steam under pressure. In this figure you can see how looked autoclave. A temperature of 121 degrees by Celsius under 50 pounds pressure for 50 minutes. Sharp instruments like scissors, needles, and other routine instruments of a surgical pack, including sharp blade. Flashing, when unwrapped instrument is autoclaved for a shorter period of time. Done for critical instrument, temperature of 131 degree by Celsius under 60 pounds pressure per square inch for approximately from 4 till 7 minutes. In field condition, large pressure cooker is used to sterilize surgical instrument and packs under maintained pressure for 45 minutes. So that's all we said about the main types of sterilization. In another lecture we continued our theme. So thank you for attention.